True or false? UV radiation produces a sensation of warmth in the skin. The correct answer is false. Warming is caused by infrared radiation, not ultraviolet radiation. Sunburn is caused by UV radiation, which cannot be felt. America's most common cancer isn't of the breast, lungs, or prostate. It's skin cancer. Every year, doctors diagnose more than 1 million new cases of squamous cell and basal cell carcinoma, which are highly treatable, though the process is painful and often disfiguring. And they will also diagnose more than 60,000 cases of malignant melanoma, which often proves deadly. Spending too much time in the sun is often the cause, but many people are unaware of how much they put themselves in danger on innocently sunny days. Two types of solar ultraviolet radiation make it to Earth's surface: ultraviolet A and B. UVA isn't filtered at all by our atmosphere. 90% of UVB radiation is absorbed by the ozone layer, but the rest reaches Earth's surface. UV intensity varies by season, time of day, latitude, altitude, sky cover, reflection, and the thickness of the stratospheric ozone layer. Too much UV exposure causes, in addition to skin cancer, premature wrinkles, immune system suppression, sunburn, and cataracts and other eye damage. Over time, ultraviolet radiation clouds eye lenses with cataracts by tangling or unraveling lens proteins. About 13 million Americans over 40 have cataracts. The World Health Organization estimates that 20% of cataracts may be caused by UV exposure. Fair skin is most vulnerable to UV radiation and cancer, but tanned or naturally dark skin are both still vulnerable. Wrinkles are no laughing matter either. Up to 90% of skin changes attributed to aging are caused by sunlight. The sun also frequently discolors skin with red, yellow, gray, or brown spots or blotches, and causes it to sag, dry, and coarsen. New research also suggests that UV radiation may promote infectious diseases and hinder vaccines, and the harm from radiation exposure is cumulative. Exposure in everyday life may be as important as exposure during spring break trips to Cancun. Sunlight does have its benefits. It can lift mood and help fight depression and seasonal affective disorder, and a little sun is beneficial for vitamin D, which is made naturally in skin from cholesterol by exposure to UVB. But it's easy to overdo it. Sunscreen still lets a little UV through, and this is usually sufficient to generate enough vitamin D in people who spend time outside. In addition, vitamin D supplements and food rich in vitamin D do just as good a job as sunlight without the health risks of UV. The UV index can help you alert viewers to times when they need to avoid the sun. When reporting or discussing it, suggest some simple actions they can take to avoid overexposure. The UV index peaks at noon, when the sun is highest in the sky. Rescheduling outdoor activities to early morning or late afternoon is a great way to reduce overall UV exposure. Also, emphasize general sun protection steps, like remembering to use sunglasses with 100% UVA and UVB protection, make note of local factors that can affect daily UV levels, and encourage special protection for children. What is America's deadliest type of hazardous weather? Heat is the United States' most deadly weather-related killer. On average, over 1,500 people die in the U.S. each year from excessive heat, more than average deaths caused by hurricanes, lightning, tornadoes, and floods combined. Some studies estimate that the actual mortality for several vulnerable U.S. metropolitan areas is closer to 10 times the number in official tallies, because heat death criteria on death certificates can be very strict. Yet most of these deaths are preventable. Heat causes harm by overloading the body's heat removal system. The body can either radiate or conduct heat directly to its surroundings, a process inhibited by high temperatures, lose it by convection to the wind, which only works if the air temperature is lower than body temperature, or remove it through evaporation of water or sweat, which is inhibited by high humidity. Sweating, by itself, cools nothing without evaporation, which sucks energy from the body through conversion of sweat to water vapor. So when temps are above 90 degrees Fahrenheit, 32 Celsius, or the humidity is above 60%, the body's cooling system may stop working. Dry heat isn't necessarily safe either. Hot, dry winds speed dehydration, which short-circuits sweating. When heat gain exceeds heat removal, or when the body cannot compensate for fluids and salt lost to sweat, the body's core temperature begins to rise and cause heat cramps, heat exhaustion, or heat stroke. The extra heat damages the brain and other vital organs. Heat can kill in other ways, too. Hearts may fail when strained by the increased circulation required to hold body temperature steady, or to overcome the effects of dehydration, which thickens the blood, making it harder to pump. Heat waves inflict the most damage in the Northeast and Midwest, and the least in the South and Southwest. Some suggest that people who are most vulnerable are not as acclimatized to high temps, and that the buildings in southern regions are better designed to handle heat. Those particularly at risk for heat illness include the very young and old, the obese, the homeless, the poor, the socially isolated, and those with heart disease, mental illness, poor circulation, dehydration, or intoxication. People on drugs for depression, insomnia, and poor circulation may also be extra sensitive to the heat. Another type of heat stroke kills healthy people, especially healthy men aged 15 to 45, when they overexert on a hot day. The excess body heat generated by exertion overwhelms the body's ability to cool itself, triggering a collapse that can happen in a matter of minutes or hours. Prevention is the best protection from heat-related illness. Those who are vulnerable should be helped to an air-conditioned location if possible. Everyone should minimize strenuous activity during a heat wave. You can help prevent heat strokes in your community by talking about this danger on air, advising viewers to seek protection either via air conditioning or by going to a cooling center, asking viewers to look after vulnerable people, and reminding viewers to avoid strenuous exertion. What kind of weather do you think prompts the most heart attacks? Though heat strains hearts, the answer is actually winter storms. According to a 2004 study, 53% more heart attacks occurred in winter than in summer. January had the most, with twice as many heart attacks as July. Winter heart attacks are also usually more serious and more damaging. Cold itself seems at fault, along with the exertion of shoveling ice and snow, which stresses weak hearts. Blood vessels also constrict in cold weather, straining the heart further. Heart attacks aren't the only way cold kills. Between 1997 and 2006, an average of 18 people a year froze to death. In cold weather, people lose body heat faster than they can make it. Cold temperatures can muddle thinking and sap strength. Hypothermia, or low body temperature, is insidious because a person may not realize it's happening and won't be able to do anything about it. Remind people to dress warmly and in layers indoors and out, and advise seniors to set thermostats no lower than 68 degrees Fahrenheit or 20 degrees Celsius. Though hypothermia is most likely at very cold temperatures, it can also happen at temperatures above 40 degrees Fahrenheit, 4 degrees Celsius, if a person is soaked in water, sweat, or rain, or chilled by wind. Winter weather poses other health hazards, too. Seniors often slip on ice and fracture brittle bones. A Norwegian study of nearly 11,000 seniors found that those aged 65 to 79 had 1.3 times the chance of sustaining a fracture in a fall between October and March than in the rest of the year. Remind seniors and others with mobility problems to be extra cautious during icy conditions, and advise viewers to keep steps and walkways as clear of ice as possible. When cold weather freezes fingers, toes, ears, and noses, it causes the irreparable tissue damage we know as frostbite. Ice crystals that form inside cells puncture and destroy them. As the extremities freeze, the flesh turns numb, white or grayish-yellow, and unusually firm or waxy to the touch. Contrary to popular belief, the frostbitten body part should not be rubbed, massaged, or covered in hot water. Instead, use frictionless warming by body heat or warm water. Winter driving also requires caution. Encourage viewers to avoid traveling in low visibility conditions and be alert to the possibility of black ice on roads, overpasses, and bridges. When driving can't be avoided, suggest using tire chains and taking a cell phone along. Drivers should also let someone know where they are going and when they expect to arrive, and make sure their car is properly serviced and stocked with winter driving supplies.